Okay, so I think we'll probably have a pretty quick meeting today,
Yeah. So
but we wanted to take the time to share and reflect on our experiences with the Hill Day last month. Also, there is a recent designation through the NIMHD for medically underserved and what that means. So we'll have a time for discussion, any questions, anything else that you all want to share about. But is there anything to add? Is there anything that needs to be clarified?
no, I think that's good. And then if you want to just maybe make mention of the Tuesday's event too.
Yes.
Yeah. So
If everyone is aware of the open national meeting, that's taking place next Tuesday through Thursday. That's October 24th through the 26th. If you have not registered and are looking for that, I'll find the registration link. But oh, and I see Kansas is doing a Project Echo series on disability, so that's great too. I'll throw that in the notes. Kathy, thank you. So okay. So I guess if we want to start with any Hill Day thoughts, experiences, excitements, anything
yeah,
that
did you want to talk about it from like a broader perspective, or do you want to just do you just want everyone to kind of share out their experience?
well, yeah, I guess for folks that have not heard about the Hill Day or didn't participate, it's something that Open does annually as an effort to reach legislators in all 50 states. And as a network, it's how we kind of come together and map out what's going on, what are the trends and all the things happening, and what do we as a national network want to advocate for. So each year we've come up with 3 asks of legislator or of Congress. So this year, gosh, let me figure them out. I know it was CDC program funding for states. There was veterans oral health, and then designating individuals with intellectual disabilities as medically underserved population. So that would expand access for those folks. And so those were the 3 for this year that we went and advocated for, had all the talking points and all of the different kind of, reasons behind why these are viable asks and what we can do about it. So we had members share, I want to say that we reached like almost 40 states, maybe. I'll have so those high level things I'm completely, I cannot share those right now. But yeah, it was a wonderful event. I know that we've had a lot more sign-ons as a result of that. So I think we'll share probably next week what the impact is that we're hearing at large. So I think that if there's anything else, Barbie, that you can think to share about the event.
Yeah, no, I mean, I think a lot of it, like you said, will be covered on Tuesday, but I mean, it was like incredible in terms of the reach. I mean, the notes that we have in our deck for Tuesday, I mean, 107 legislators, 42 House members, 62 Senate members, and the increase from the years prior is like incredible. I mean, it was like, I was blown away when we did our recap meeting. So it was pretty significant. And sorry, my son just got down. My son just got home from school and he's getting his snack out. In terms of the specific legislation, like Francis mentioned, we had quite a few members that actually signed on. We also, like everyone knows, made the ask to the Senate to come up with some sort of companion bill. A few of us had the opportunity to meet with key members of the Senate Health Committee, who were all very interested in the legislation. One of them had actually just signed on. It was the senator from Paul Tonko from New York. His health person had just let us know that he had just signed on the day prior, so that was incredible. And then the senator from Alaska, and I'm blanking on her name, they asked for a ton of additional resources and seemed very interested in it. So I think that was very powerful. Just some of the other feedback, the post was, we really tried to identify an individual with a disability to be on those calls, and we were partnering with the Special Olympics. They were trying tirelessly to line people up in those key markets. We had a few places where we were able to do that. I think next time, or as we continue to do these meetings, maybe by ourselves, we will make sure that, you know, the community is represented either by a caregiver or, like I said, in the individual themselves. That was just some of the feedback from some of the other states that they were meeting with, to make sure that we had somebody representing the community. So that's always really, really important. So other than that, like I said, it was extremely successful. And I don't know if anyone else wants to add maybe some successes that they had on the calls themselves. So I'll just pass it back to anyone else who has comment.
Share from my perspective. This would be my first time doing an open Hill Day. I've done other Hill Days in the past, but my first one through open. And I was lucky enough to be part of the Pennsylvania cohort with Vanessa on the call. So it was really wonderful for you know, me to have her as the expert in the room to really talk about the Heads Up Act specifically. But the thing that I really just that I want to highlight on, you know, an open level or the whole organizational level is how wonderful the materials were and what an impact they had. The fact that one of the offices that we met with, the legislative aide, actually had our materials in front of them, had read them ahead of time, was able to talk about them, really gave us the opportunity to engage on a different level, because we didn't have to start with that basic level setting piece. So really just commending the work out of this group to prepare those materials for all of the participants. And they really did make a great impact. So I'm definitely going to be taking a lot of the you know, just strategies and information and, you know, everything that was successful on this open level, and seeing what we can do to kind of emulate that when we do our own statewide Hill Days, whether they're virtual or in person. So really, really thankful to be a part of it.
And I have to piggyback on that and just to shout out to Nicole. PCOH had 3 oral health bills pass in the House or the Senate, or both. I read through the thing, so I just wanted to give kudos to Nicole and Helen at PCOH for that great piece of news.
Incremental progress, but yes, it's been a very busy legislative session for us. Fortunately, nothing specific to our, you know, statewide EMUP initiative, but we're still working hard on that. But we had 3 pieces of legislation. At least 2 were voted out of committee, and 1 is on its, it'll be getting prepared for its 3rd consideration. So yeah, we're getting there. One of them was to address the adult Medicaid benefit, working to get our comprehensive benefit back. The other is one related to allowing our PhDHPs to provide the school dental screenings that we have mandated in our state. And then the 3rd bill is related to the asking our state board to codify teledentistry. And I have more information on that. I don't want to take away from, you know, Heads Up or anything like that, but thanks, Vanessa.
Nice job. Very nice job. We appreciate the work you do. So anyway, I'm sorry that I'm late.
No, we're glad you're here.
Senator Fetterman's staff loves Heads Up, so they're kicking it up to the LD.
Nice. That's awesome. Yeah. And I just forgot to make mention. I know Bianca's working on, I think she's got a list of additional members that wanted to reconnect and discuss a little bit deeper in detail. So I think once we get through next week, I think the plan is for us as a group then to just really, focus in specifically on those other members that wanted some additional information from us. So it was all so positive. Like, in talking, I don't think Steve Perlman's actually speaking in a conference today with Mary Foley from MISDA, who did some of the calls. And I think from his perspective, who's somebody who is part of the initial legislation and the drafting of it, he was even so thrilled at how well it was put together, to echo what Nicole said, but then just like the enthusiasm and just the momentum that's finally coming. And we really do owe that to Opened in making this one of their initiatives. Like, I'm just so thankful. Like, I can't even express that enough. So.
I want to jump in also, just with that update and hearing that Pennsylvania, you're asking the state board to really look into teledentistry and how that's been implemented and anything that you can codify and share back. I think that is huge. And also, Nicole and I, we were on the rural network response team earlier, and that really relates to the work going on in rural. And last year there was a roundtable series of events that really like did a deep dive, but we highlighted the contrast between Pennsylvania and South Carolina and teledentistry in those states and the legislation that was allowed through COVID. So I think kind of like unpacking what that means for states and the expansion of access, that's huge. And I also love hearing that it's these strategies that Open kind of delivers across the board that is really, it's like, this is the impact Open can make, and you can make the same impact at any level, right? And it's just kind of like figuring out like what do we need to say? What are the resources that are going to help us say it best? And then like who do we need to talk to in order to continue to move these things? So I think the Hill Day and all of that is just like, this is a great kind of emphasis on what, just Open at large.
And to piggyback on Hill Day, I'm guessing that we're talking about Hill Day debrief, but Hill Day was such a phenomenal success. I mean, I don't know if people realize that the network talked to 107 legislators, 90 advocates from 35 states, 45 representatives, and 62 senators received advocacy materials for our ask. And then shortly after that, and I want to credit Hill Day for it. Maybe it didn't have anything to do with it, but maybe it did. Governor Shapiro's office is finalizing the letter to, I don't know if I told people this yet, they're finalizing the letter to send to Secretary Becerra to ask that Pennsylvania, they cut it down. We asked for Pennsylvanians with disabilities, and they did cut it down to developmental disabilities, but we'll take it. So they're writing the letter to ask for the exceptional medically underserved population designation from Secretary Becerra.
That's awesome. Yay. You're going to be the first. Pennsylvania is going to do it. I know it. I feel it.
And then we're gonna give everybody the secret sauce recipe.
Exactly.
So
that's how it works.
Does it? Everybody's gonna do it.
Vanessa, that's amazing. I'm so excited. This has been a week of jumping out of my chair. So I'm super pumped. Just for my information, obviously we can talk offline about it because we want to make sure to share that great news through our network. Do we have any anticipated timeline on when Governor Shapiro may be making that ask, or if there's going to be anything we can do to help support Achieve in promoting that?
So we were a little nervous because there was a lot of radio silence before that. And then they just suddenly came back with, I sent Meghna Patel a letter asking, hey, are you still thinking about this? And she wrote back and said, yeah, we're finalizing it. So we asked to review it before they sent it. So I believe that the Department of Health and DHS are probably with legal are working to hammer that out. But once I get my hands on it, yeah, anybody who wants, let's look through it with a fine-tooth comb and see what we can do and what's in it. But yeah, that's just the first open door, I hope. And I hope that after this, I hope everybody does it.
Yeah, exactly. I guess that's a good segue into the great news that we received from the Department of Health and Human Services and the Minority health disparities in the designation. I mean, who knows if this was a part of it, and we were all talking behind the scenes because originally a month prior they came out against the designation. And so, and I know Vanessa was on some of the emails trying to figure out why did they, all of a sudden do this 360. We did learn from, the mat holders and the RIC raters that apparently Andres Gallegos, who's the chairman of the National Council of Disability, wrote a pretty powerful letter to the director to say, how can you do this? And a ton of other disability agencies jumped on board. They really, really called them out. And I don't know if anyone wants to read it, it's on the National Council on Disabilities website. He sent the letter on September 6th to the director and just really called them out on what a detriment even just doing that was. And then all of a sudden they did this 360. So I think it was a combination of things. I think it was, seeing the movement of stuff that's happening around the legislation, but then also the letter from the chairman himself to say, listen, you need to change this. And so it has happened, which is obviously one of the things that's within the ask of the heads up legislation is that research dollar. So we still want the heads up legislation. That still is paramount and something that we'll continue to focus on. But this is a small piece of it. And it's a pretty big win that we can now, communicate and publicize. So, I mean, it's little by little, everybody's chipping away and it's really exciting. So I don't know, Vanessa, if you want to jump in or Ellen or.
I just have to say that this group gets a lot of credit because I mean, that ask has been sitting there for 20 years. People have been working on this. And, my hat's off to all the people who worked on it before, but it wasn't until Open and CareQuest really picked it up and got behind it that it really started to move. And a lot of credit goes to this group for doing that. So pat yourselves on the back.
All right. Well, I guess next up is just any other updates. So I don't know, Francis, if you want to take this piece of it or.
Yeah, well, so the meeting is next week. The big old open national meeting. I think I might have the Hoover app, if not open now. Have you all seen the Hoover meeting app?
I think so, but
it's quite cool. If you are attending, you'll have you'll have a link. I think the registration's closed if anyone has not. Has anyone not registered that wants to? I guess I should start there. No, everybody's good. Okay. Well, I'll just show you this real quickly, and I'll also drop it into the chat so you can play around with your own. But all of the event information is in here, so you'll find the agenda, you'll find all the links. There's a lot of different Zoom rooms that we'll be bouncing around through. So like think of this as the hotel, and this is the main lobby that we're all going to be kind of mapping through. But we're hoping to see a lot of engagement with the communities. So when you come in here, there's a whole bunch. There's literally a block of ice that you can break and introduce yourself through icebreakers. So that's fun. And I'll skip this for now. But you'll see the organizer announcements here. Any questions that you may have. Here's the icebreaker one, which is pretty funny. But any of those, and start your own, and anything you want to share or post. You can also win prizes through a lot of really fun things, like a photo booth. And many of you will be receiving a box that should be coming probably today or tomorrow if it hasn't already, but that's all the open swag. There we go. Yay.
I know I got mine and that was very exciting. Thank you.
Isn't it cool?
It is very cool. Very nice.
Yeah. So I'm really excited. I think the agenda is shaping up really well. You can access the links and everything in here in this little agenda room, so you can just add whatever you would like. Are there any questions about anything that is coming up? Because this is pretty, I think this is our last NRT meeting for this group for the year. And then the national meeting, of course, is kind of our big grand finale, and so much to come with all the Blueprint 2.0. What does next year look like? So stay tuned.
Yeah, I mean, thank you. I mean, I think us as a group, I mean, like I said, it's nice that we definitely have a very strategic focus for what we're trying to accomplish within this group. So, like I said, we'd love for, as we start to do some follow-ups with the legislators, we'd love for anyone and everyone to be involved in those additional calls that we're going to be doing. So, yeah, and just thank you to everybody. Like Vanessa said, it takes a village, and me and everyone is so integral in this movement. So thank you everyone for what you do and your passion for this population.
Massive.
Yeah, just to echo Barbie, we still need you. Even though we talked to 107 legislators, we still have, a lot to go. So we still need you. And like I said, this group gets a lot of credit for getting this moving and keeping it moving. Nobody's ever gotten this far before on these things. So, Open and CareQuest and everybody in the Disabilities NRT gets credit for that. And thank you, Francis. You've been so great this year, keeping us on track,
Of course.
helping us stay organized, and we appreciate it.
I think the timing couldn't have been better. We're coming together to think through what do we want to do this year, and that was really like at the time that the Hill Day asks were forming. I feel like so much just kind of like divine timing, and I really can't think like the model itself of Hill Day and advocacy and the secret sauce itself, like this group and across Open. I think that's where our strength lies and what we're figuring out. And I know the focus for the Blueprint is really, really policy focused and advocacy based. So it's like, I just think there's so much potential for what we're able to do together when we, think through these kind of things of what's actually going to work and what can we, spread and scale and see come to fruition.
Yeah, agreed.
Okay. So if there are no other thoughts, I guess we will wrap for the day.
All right. We'll
Everybody.
see everybody Tuesday.
Bye-bye.